David had hidden his erectile dysfunction for years, feeling ashamed and frustrated. He avoided intimacy, missed opportunities, and constantly doubted himself. Then one doctor's visit led him to Viagra, and everything changed. He renewed his confidence, reclaimed his relationship, his hope, and his life. But David isn't the only one curious about this incredible drug. Many people want to know more about Viagra, Cialis, and other PDE5 inhibitors. So if you too are interested, stay tuned. In this video, we will dive into a fascinating story of Viagra, Cialis, and other PDE5 inhibitors. Interestingly, these drugs were never originally intended to treat erectile dysfunction. It was a failed heart medication, and that failure made them one of the most popular class of drug in the world. During the 1990s, scientists were testing a new drug for high blood pressure and chest pain caused by reduced blood flow to the heart or angina. And in the clinical trials, something unexpected happened. The drug didn't do much for chest pain, that was its intended purpose, but many male participants reported a very surprising side effect: longer and stronger erections. They loved this accidental effect and didn't want to stop taking the pill. And this accidental discovery led to phosphodiesterase 5 inhibitors, or PDE5 inhibitors, like Sildenafil or Viagra, Tadalafil or Cialis, and Sildenafil, and more. And these drugs completely transform how we understand and treat erectile dysfunction. But how do they work? What are the side effects? Who shouldn't take them? And how effective are they? To understand how this drug works, we first need to look at how a normal erection happens in a healthy and young person. If hormones, structures, physiology, and mood and everything else are normal, sexual thoughts, visual stimuli, certain smell or physical touch activate a specific part of the brain. The brain then sends nerve signals down the spinal cord to the penis. Once the penis is stimulated by these nerve signals, parasympathetic nerves trigger release of a tiny molecule called nitric oxide. And this nitric oxide starts a chain reaction that produces another molecule called cGMP, or cyclic GMP. Cyclic GMP causes the blood vessels in the penis to dilate, allowing a large amount of blood to flow into the penis and fill the corpora cavernosa. As the corpora cavernosa fills, the vein that normally drains blood from the penis is compressed. This combination traps the blood inside the corpora cavernosa because blood can come into penis but can't leave it, and this way increases pressure inside the penis and produces an erection. But an erection can't last forever. After a while, cyclic GMP is broken down by an enzyme called phosphodiesterase type 5, or PDE5. When cyclic GMP levels drop, the blood vessels tighten again, more blood leaves the penis, and the erection ends. So we can very simplistically tell that erection is a fight between cyclic GMP molecule and PDE5 enzyme, where cyclic GMP try to maintain the erection and PDE5 want to end it. And this is when Sildenafil, Tadalafil, and Sildenafil come into play. These drugs inhibit PDE5 enzyme activity. When PDE5 is blocked, they can break down cyclic GMP. Cyclic GMP builds up in the penis, and the blood vessels stay relaxed and dilated, blood flows continue, and the erection becomes stronger and lasts longer. But it's important to understand that Sildenafil only increases cyclic GMP and traps the blood inside the penis. It does not affect sexual desire, testosterone level, vascular conditions like atherosclerosis, nerve damage, for instance from diabetic neuropathy, or any other physical or mental condition causing erectile dysfunction. This is why PDE5 inhibitors like Viagra and Cialis work for most people, but not for all people. So if it doesn't work for you, you are not alone. Some studies show that they are effective in 60 to 70% of population and ineffective in other 30 to 40%. And they can use other modalities for their ED treatment. The underlying cause of erectile dysfunction should still be addressed if there is another contributing factor. Conditions like low testosterone, high blood pressure, diabetes, hyperlipidemia, or mental conditions like anxiety, depression, past sexual trauma, and more and more. And there are many drugs in this class, including Sildenafil, which you may know as Viagra, Tadalafil or Cialis, and Sildenafil or Levitra. They all work in similar way, but there are some key differences. Sildenafil, for example, comes in 25 mg, 50 mg, and 100 mg pill. It is usually taken 30 minutes to 4 hours before sexual activity, and in most cases, it's remain effective for up to 4 hours. But in some cases, it can last up to 18 hours. But it doesn't mean a continuous erection for 4 to 18 hours. Sexual stimulation is still required to achieve an erection. Sildenafil's absorption can be affected by a fatty meal, so it's better to take it on an empty stomach for optimal effects.
A lot of men take big steaks, baked potatoes, and dessert in the evening.
Then they go to bathroom and pop a blue pill and swallow it. It doesn't work that way. You should take it on an empty stomach for a better absorption anytime, from 30 minutes up to 4 hours before desired sex. Cialis or tadalafil has a much longer duration of action and sometimes up to 36 hours, which is why it's often called weekend pill. Because one pill can work for the whole weekend, and its absorption is not affected by fatty meal, so you can take it with a full stomach. But for faster and more effective absorption, it's better to take it on an empty stomach too. Tadalafil comes in 2.5 mg, 5 mg, 10 mg, and 20 mg doses, and doctors usually prescribe the lowest effective dose. And it is usually taken on an as-needed basis, but some men with frequent erectile dysfunction who have unpredictable sexual activity, for example several times per week, might take 2.5 to 5 mg doses of tadalafil each day to keep a steady level of drug in their blood. Or other men who hit timing, 30 minutes to up to 4 hours before sex, you should take a pill. They don't like that. They want to take tadalafil each day, 2.5 mg or 5 mg, to be ready all the time. But beyond erectile dysfunction, this class of drug have other uses too, because the same mechanism and the same PDE5 enzyme, which exists in the penis, are found in blood vessels throughout the body, in the brain and muscles, in the heart, in the prostate, in the lung, and other organs. That's why this medication quickly found uses beyond erectile dysfunction. For example, people with pulmonary hypertension take sildenafil to relax their blood vessels in the lung, improve blood flow to the lung, and reduce strain on the heart. Some athletes use it too for better performance in the gym because they increase blood flow to the muscles and boost performance a little. Some studies also suggest that PDE5 inhibitors may help reducing risk of heart attack, stroke, dementia, and Alzheimer's disease. And some women also use them for female sexual dysfunction. However, these drugs are officially approved only for pulmonary hypertension, erectile dysfunction, and tadalafil for benign prostatic hyperplasia or BPH. Other uses are considered off-label. Sildenafil 20 mg 3 times a day or tadalafil 40 mg once a day are prescribed for pulmonary hypertension. And tadalafil with a string of 2.5, 5, 10, and 20 mg is approved for BPH or benign prostatic hyperplasia. Researchers have also discovered that PDE5 exists in the heart muscles, brain tissue, peripheral nerves, kidney, and even cancer cells. Additionally, in the laboratory study, these drugs reduce heart muscles thickening, limiting damage after stroke, improve nerves recovery, and reduce kidney damage in diabetes. Some of this benefit hasn't translated into clear results in large human trials yet, but the biological potential is undeniable. So far, we have only talked about the benefit of these drugs, but no medication is risk-free. Viagra and Cialis, or sildenafil and tadalafil, whatever you call them, are no exception. Remember, PDE5 enzyme exists not only in the penis, but in many other organs in the body. So, this drug can affect enzyme elsewhere in the body and cause side effects. For example, blood vessels in the brain can dilate and causing headache, which can be severe or mild. Blood vessels in the skin can dilate and leading to flashing. This drug can also cause nasal congestion, dizziness, and low blood pressure, likely by the same mechanism. Relaxation of muscle ring in the stomach can lead to heartburn and indigestion. Sildenafil can cause a temporary blue tint vision because it affects the enzyme in the retina. Tadalafil may cause muscle and back pain due to its effect on skeletal muscles. Rare but serious complications also exist. Sudden vision loss or hearing loss rarely happen, and in some cases can be permanent. But most patients who experience these serious complications have pre-existing conditions that make them more susceptible to developing these side effects. But not all of them. Not all patients who develop this serious side effect have pre-existing condition. They can also cause a serious condition in the penis called priapism, which is a prolonged erection lasting more than 4 hours. During priapism, blood gets stuck in the penis and becomes deoxygenated. And if you not treat it within 6 hours, the tissue can die, leading to permanent damage or loss of the penis. And this is a medical emergency. If you experience it, you should go to urologist as soon as possible to sift the penis tissue. Urologists treat it by draining the penis by a large needle to restore blood circulation and sift the penis. Priapism can happen in anyone who take Viagra and Cialis, but people with sickle cell disease, leukemia, multiple myeloma, and other blood disorder or structural abnormality are more susceptible for developing priapism. For people who take nitrates for anginal chest pain or other problems, They should never take these drugs on the same day with PDE5 inhibitors like sildenafil and tadalafil. This is because nitrates increases the production of cyclic GMP while Viagra and Cialis inhibit its breakdown. The combination can cause cyclic GMP to build up, leading to a dangerously low blood pressure which can be fatal. Low blood pressure can also occur when PDE5 inhibitors are combined with alpha blockers like terazosin, prazosin, and temsolizin. Old men with BPH usually have difficulty urinating and they might take alpha blockers for relieving these symptoms. When they take them in combination with Viagra and Cialis, both of them lower blood pressure. In these cases, blood pressure must be monitored closely. Dose adjustment also needed in people with advanced liver disease and kidney disease. But these drugs are overall safe drugs. Erectile dysfunction is rarely just about sex. It's often related to blood vessels, nerves, hormones, and most often, mental health. Treating the underlying cause is just as important as taking PDE5 drugs. Controlling diabetes, managing cholesterol, quitting smoking, addressing psychological stress can sometimes resolve the problem without any medication at all. Still, many people wonder which is better, Viagra or Cialis. Thousands of people taking this pill, and researchers go and ask them which one is better. And the real participants in the study provide the answer. And if you have free time, check our other video where we covered that study in detail. I will see you there.